I'm Christian Latham. I'm one of the general surgeons in Hot Springs, Arkansas, and I work for surgery specialists at Hot Springs. Reflux is when you have gastric contents or gastric acid that goes back up into the esophagus from the stomach. The process is that the bottom part of your esophagus, called the lower esophageal sphincter, is not staying tight enough to keep gastric contents, acid, from going up into the esophagus. The esophagus is not meant for that low pH level, and so it's uncomfortable when that happens. The medications change the pH level to where those reflux materials don't hurt when they come up, but they're still coming up and can still cause a lot of the same secondary symptoms besides the heartburn. Even though the heartburn's treated, the actual reflux is still occurring. Surgery actually stops the process of reflux by tightening the bottom of your esophagus and keeping the gastric contents from coming back up. Typically, any patient that has reflux is an ideal candidate for this. Most people do well with anti-reflux medications, and if you're on one medicine or so and doing real well, we typically let them go ahead and continue on with that. But folks that are on multiple medications and still not getting relief, surgical intervention is very good for those patients. Typically, reflux surgery involves one surgery with two components to it. There is an intrinsic problem with the lower esophageal sphincter, which we have to repair with a procedure called a fundoplication. And a lot of times people have a hiatal hernia or a paraesophageal hernia, and that's corrected at the same time as the fundoplication. The surgery involves a one-night stay in the hospital. It's considered outpatient with a 23-hour observation. The surgery typically lasts about an hour to an hour and a half, and it's done laparoscopically. You have 5 poke holes at the end of the procedure. Once the surgery is done, you stay in the hospital for one night. We do a swallow study the following morning, just make sure everything looks okay and there's no injuries, and as long as that's okay, you get started on a diet and go home. Recovery is about 2 weeks, no heavy lifting or straining, but general everyday activities we're fine with you doing. The biggest restriction after the surgery is with your diet. We have to give you a soft pureed diet with no bread or meat for about 6 weeks to allow time for the healing and swelling to go down. The day after surgery, we typically stop patients off of the medications if they're strictly for reflux. If they have peptic ulcer disease or some other process they need them for, we can keep them on that. But people that are just strictly being treated with medicine for reflux, after the surgery, they're done with them.